In the U.S. healthcare system, the BARRC is the bite. I am a physician, and that's me. My name is Dr. Deane Waldman, and you are now watching one of my webinars on healthcare. For those of you who don't know me, I'm a professor emeritus in pediatrics, pathology, and decision science. I serve on the board of directors of the New Mexico Health Insurance Exchange as the consumer advocate, and I'm honored to say I was the author of the book, The Cancer in the American Healthcare System. Some of the titles in this series include the following: What's really happening in healthcare? Should I buy health insurance or not? What would a good doctor do? Is the Affordable Care Act the answer? Single payer won't work. Government BARRC is its bite, and we will discuss that in detail today. The cure for our healthcare system, Direct Pay USA. Why we don't need tort reform. Why my doctor can't see me? ? Today we will discuss specifically what is BARRC, some of the myths surrounding this thing I've invented called BARRC, abbreviation I invented, including the fact that it's free, that it reduces spending, that it assures quality. I'll give you some examples and show you specifically how BARRC bites us in the rear end where our wallets are. And then, of course, as always, try to answer the question, what next? What should you do? What is this thing called BARRC? It is the bureaucracy, the administration, all the rules and regulations, as well as the compliance, namely what is mandated in terms of behavior of physicians and nurses and executives and so forth, as well as the oversight of that compliance by the federal government. We're going to discuss some of the myths of BARRC. A myth is what I like to call accepted wisdom that is neither. It is not wise, and generally it isn't accepted. In the book, The Cancer in the American Healthcare System, we discuss 8 different myths of BARRC. 3 of them we'll mention in this webinar, and the single payer one is so important that it has its own webinar. Today, we'll talk about BARRC doesn't cost me anything, BARRC will reduce national spending, and BARRC assures quality of medical outcomes. Now, let me say before I start that BARRC is the way that the government actually intersects with our day-to-day lives. So you could, if you like, substitute in your mind government wherever you see the word BARRC. BARRC doesn't cost me anything. Well, let's think about that. The Affordable Care Act cost millions of dollars just to write the thing and print the thing. We won't discuss the, shall we say, less than ethical legislative process, but it cost millions upon millions of dollars. The implementation is going to cost $2.6 trillion, not billion, trillion dollars. Of course, there is the compliance and oversight costs on an ongoing basis. There are repeated changes to the law, and every time, as anybody who's ever built a house knows, anytime you have a change order, it costs money. So the bottom line about BARRC doesn't cost me anything is you and I pay these costs. BARRC ain't free. Now, another one. BARRC will reduce national spending. I would defy anybody who's listening or anybody anywhere to give me a good example of how a government administrative activity, name one, is cheaper than the same activity in the private sector. I'm waiting. I know nobody's going to respond with anything because there isn't anything. Before the Affordable Care Act, federal BARRC cost 40% of all healthcare dollars. And if you want proof of that statement and the next one, please read The Cancer in the American Healthcare System. With the Affordable Care Act now implemented, BARRC is taking roughly half of all the healthcare dollars that are spent by the United States. And if we're talking about national spending, how do you know or even think that BARRC intends to reduce national spending? Well, let me use the word that they don't want to use, but is true. It is medical rationing. That's how the Independent Payment Advisory Board will try to reduce national spending. They'll simply say, as they do now in Great Britain, the model of the Affordable Care Act, well, if you're over 55 years of age and you need kidney dialysis, too bad. We don't authorize it. You can't get it, so you just die. That's the reduction of national spending through medical rationing, and I don't think a single American wants that to happen. Finally, we have BARRC assures quality. Well, let's discuss that for a second. In BARRC, R&R stands for not rest and recovery. It stands for rules and regulations, and that mandates behavior, whereas the C is compliance, which includes the oversight of that behavior, which is the measurement activity of the BARRC. Let me just say it outright. Compliance oversight doesn't measure quality. Compliance oversight measures compliance with regulations. Now, management people or anybody who's experienced in business will tell you that you get whatever it is you measure. So if we're measuring regulatory compliance, we get regulatory compliance, and we don't get those quality outcomes as patients that we want and expect. BARRC simply doesn't do that, was never intended to do that, and can't do that. Some examples, you ask, of BARRC. Well, there is the Joint Commission, now just called Joint Commission, used to be the Joint Commission on the Accreditation of Hospitals and Health Care Organizations, but they just shortened the title. They review every one of the 5,200 hospitals in the United States. But what do they review it for? They don't review it for how patients do or what their infection rate is. They do their reviews on a 3-year basis or more frequently to see if you're complying with regulations. So my question is, where's the evidence that shows that the Joint Commission improves patient outcomes? Again, I'm waiting for an answer, which I know will never come, because there is no evidence that shows that the billions of dollars spent and the millions of man-hours wasted by the Joint Commission and through the Joint Commission activities do any good for you or me in terms of patients. ICD-10 is a new code book. It contains 148,000 codes for various medical conditions as well as procedures. Question: do you, as a patient, benefit from the billions, repeat billions, of dollars that are being spent to write, to send out, and to implement by force the ICD-10 codebook? Answer: no, you don't benefit, but we're spending billions to do it. Then there's HIPAA. Ask any nurse or doctor about HIPAA. They probably will turn their heads and spit. The fact is, this is a federal law that prevents us from communicating with each other and wastes an enormous amount of time without doing any good for the patients. Federal regulations. Question: who pays for them? And more importantly, we already know the answer to that one, how much do you pay? Well, let's look at the growth of federal rules and regulations. In 1976, there were roughly 7,406 governing regulations for the practice of medicine and for the healthcare system. In 2009, there were 169,593, and that was just before the Affordable Care Act was implemented, as you know, that contains regulations that took over 10,000 pages to write in the Federal Register. Were these rules and regulations free? Again, one of Dr. Deane's rhetorical questions. Who is the number one recipient of healthcare dollars, healthcare spending? Answer, BARRC. I found two cartoons that I thought you would enjoy. One is, I'm from the government and I'm here to help. And the other one is, don't steal. The government hates competition. And I have to admit, I cheated a little on that first cartoon because initially I cut out a little bit. I wanted to show you the other half of that cartoon. The answer is BARRC takes more healthcare dollars than hospitals, doctors, and Big Pharma all combined. And there is a whole webinar that is dealing with where our healthcare dollars go, and I urge you to look at it. And if you want proof of everything I'm saying, the evidence is literally written down in that book, The Cancer in the American Healthcare System. Finally, I wanted to show you exactly how BARRC bites us. It bites us by what I call diversion. Firstly, the government takes whatever amount of money it needs to create six whole new federal agencies in the Affordable Care Act. As I said, those 10,000 pages of rules and regulations, and all the lawyers and accountants and actuaries and so forth. Then the corporations take their piece, the insurance, the Medicare trust fund, etc. They take their chunk, and what is left over, that's what's available for you and me. And as you have just heard, half of all those healthcare dollars get taken away by government BARRC. What is your next step? Your next step is to go visit our website. It's free, wecanfixhealthcare.info, not .com, .info. I urge you to consider all the information, the facts, the truth on that website. I suggest that you look at the other webinars and write down that URL. It's an abbreviated one, of course. And I especially want you to look at the one about where all the dollars are going. And finally, I recommend that you read The Cancer in the American Healthcare System and arm yourself with the facts, the truth, with evidence to back up everything that is in there already in the book. Thank you very much for joining me today, and I look forward to discussing with you at other webinars.